Hi, this is Jessica DeMassa, and I'm at the HISA studio here at HIC 2017. I'm with Trish. Trish, please introduce yourself for everybody watching.
Hi, I'm Trish Williams. I work at Flinders University and I'm the Professor of Digital Health Systems and the Cisco Chair.
Fantastic. And so I understand that you're a bit of an expert when it comes to safety regarding e-health. Is that right?
Yes, that and cybersecurity in health. Been working in that field for a long time, so it's all wrapped up with e-safety, patient safety, medical devices, and cybersecurity.
Okay, so let's talk about this a little bit because I'm really interested from like a macro level. You know, what's going on? I mean, we're talking a lot about data. There's a lot of new apps that are out there that collect information. There's a lot of devices that feed information in. So talk to me a little bit about what are the things that are concerning, or what should we have our eye on as far as security goes in healthcare?
Well, there are many things to have your eye on in security. There is the information protection itself, so whether it's privacy and looking at privacy regulations and privacy legislation, and as well as the cybersecurity itself and making sure that basic security measures are put in place for whatever network you're running your data over. And sharing data is becoming more of that emphasis that we need to have a look at from cybersecurity.
Okay. When you're teaching this, do most students, are they aware that there's so much protection that needs to take place with data in healthcare?
No, and neither are the organisations. In fact, neither of the people. People in healthcare do realise that we need it, but they underestimate or don't quite get the enormity of the problem that we have, and don't really quite know where to start. But it's not surprising because cybersecurity is not core. It's not core business for healthcare. We're, treating patients is the core business. Mm-hmm. And so when we look at things like cybersecurity, we're expecting people to be able to do it and integrate it into everything that they do, but without the skills to be able to do that. So my mission is to be able to make cybersecurity in healthcare practical so that everybody can do it.
Fantastic. So what are some of the gaps? Like, what makes it impractical at this point?
A lot of the things that we have in place for authentication, so everybody uses a sign-in, a username and a password, and we still rely on passwords as our primary method of identifying and authenticating to a system. But we're really bad with passwords. We're human beings, and we're really not good at managing that. And we haven't found other solutions that work really transparently and quickly in healthcare. And that's the problem. We need to make security enabler to healthcare to be able to get data. But in fact, we still have a very paternalistic model of security. Sure. Where we want to control everything.
How do you balance that? How do you balance that sense of control versus that sense of freedom and access?
Carefully. It's always a challenge to do that, because you need to have sufficient protection, but at the same time the whole emphasis is having access. The more you can integrate it into workflow, clinical workflow particularly, and what people do, the better it will be. And also integrating it into culture, that people are conscious of what they're doing. I think we have a huge emphasis on cybersecurity because it's in the news for everything, whether it's terrorist type attacks, whether it's botnet attacks that we've seen in the news, the Mirai and the Mirai botnet and the ransomware. Yes. That was around the world. Mm-hmm. And it's not that you can actually protect yourself against all of those things. There's going to be cybersecurity incidents, but you can do things to minimise that and also make sure that you're resilient to be able to recover from those things when they do happen.
So contributing to that resiliency, what does an organization need to know?
They firstly need to know what it is they're trying to protect. In the hospital environment and medical devices particularly, it's really hard because you have hundreds of thousands of devices, and rarely does the hospital environment know exactly how many devices they have, where they're located, what type they are, what version they're running, what the update schedule is, are there any updates that protect them? Because that type of technology is not the same turnover as we have IT type of technology. Right. So actually managing those things, they need to be quite tightly managed, but they're very large activities to do and inevitably very difficult to do in the hospital environment.
So here we are in this age of like Internet of Things and all of this big data and the apps that are collecting data, and there seems to be more data than ever and more places that data can come in and go out. Yeah. Should we be worried?
No, I don't think you should be worried. I think you need to be aware. Aware of what it is that you're doing, what you're collecting in that clinical sense, and being aware of what it is that's happening to that data and what the vulnerabilities are around what you're doing. I always like to think that security is common sense, although everybody tells me it's not very common. But it's more about if you know what it is that you've got and you know how to manage it properly, then we really shouldn't be as concerned about it. But we need to have better practices in place to be able to do that. And relying on guidance, international standards, those sorts of things is what we should be relying on.
Okay. Last question for you, because I'm curious. I mean, you have this such a passion for talking about the cybersecurity and the side of it. How are you bringing this into the classroom? And it's so interesting that you're doing it in a digital health program, leading that way. So talk to me a little bit about your approach there.
Well, I work a lot in international standards with ISO and HL7, so a lot of security, either security standards and health messaging standards. And I tend to integrate that into the classes. So if we're doing, trying to teach people how to do enterprise security, then it's all about how do you pick the enterprises that you are looking after. So I'll quite often use healthcare as an example for that. But it's more about teaching them how to think around the problems rather than specifically for particular contexts. But it's the same approach when dealing with all of the hospitals and different organisations, is to help them understand what their problem is, because it's then much easier for them to be able to put solutions in place.
Fantastic. Well, thank you so much for joining us. It was lovely to speak with you. We would certainly appreciate hearing your perspective. I'm Jessica DeMassa from the HISA studio here at HIC 2017. Thank you.